what do you do if you're not going to give somebody Norco? Well, this is a group, a study where they looked at vitamin D versus placebo versus mindfulness and vitamin D. So this is a 28,000 international units of vitamin D per week for 12 weeks. Okay, so it's a 12-week study. They had 4 groups. One group of patients did mindfulness training with vitamin D supplements. One group took a placebo. One group did mindfulness training with a placebo. One group just did mindfulness training. And what they found was that all of these groups got better except for the placebo group. But the group that did the best was the one that supplemented with vitamin D and did mindfulness training. So remember what I told you, Dr. Melzak said pain is in the brain. So if you get the right mindset and you do, and I don't train people in mindfulness, I'll send them out for it. I try to do my own mindfulness and things like that. But you know how you hear about pro athletes doing biofeedback? That's kind of mindfulness training. But if you can get a good cognitive behavioral therapy or a mindfulness-based pain therapy program, there is a lot of pain you can modulate and control just with that. And then if you add vitamin D3, because there are D3 receptors on the nerves and on the neurons and all throughout the body that control inflammation. D is actually a hormone. It's not really a vitamin. It functions like a hormone. So D deficiency is a big problem that is a source of a lot of our issues in this country, one of which is chronic pain. So remember this, mindfulness-based training plus vitamin D, they did great for nerve-based chronic pain. And yes, it does work. So the biology of pain, like this talk I'm giving you right now, was explained to another group of 66 patients, and then they were trained in mindfulness to control stress, to sort of manage the normal stress we're always under in our daily lives. And then they were also offered standard medications. Pregabalin is Lyrica, duloxetine is Cymbalta, or a tricyclic antidepressant. 63% of the people in the mindfulness-based training group improved. Only 22% of the controls did. So they were all offered the same meds. Just one group was taught, this is what pain is, and this is how you can use mindfulness for it, and the other group was not taught that. So they were not allowed to know. They were not empowered. The empowered group did way better than the unempowered group. So that's why I do these talks on a Saturday morning, is I'm trying to give you guys the power to manage your own issues, because you can. There's so many things you can do without coming to see somebody like me. And then the people in the mindfulness-based stress reduction protocol had better function, less pain catastrophizing. So that's an actual thing. There's actually a test you can take to see if you're a pain catastrophizer. So these are the people you see that like roll their ankle and act like, they were just shot with an AK-47. Like, it's just the end of the world. Nothing can be done. Everything's over. Oh my God, it hurts so bad. I can't move. Like, it's just so catastrophic. There's actually a test to take. You can actually grade this and scale people. Some people catastrophize, some people don't. Some people are very stoic, some people are not. But you had less catastrophizing after mindfulness-based training. Less depression. Again, it's the same neurotransmitters, remember? So if you can control the central processing unit, you also can control the mood. Less perceived stress, and then QOL is quality of life. So a better quality of life. Now, what I will tell you, this list here, the exact opposite is true for chronic narcotic use, which begs the question, why is that covered at all? I don't know. Most people on long-term narcotics, less function, more pain, more catastrophizing, more depression, more perceived stress, worse quality of life. I think we all have somebody in our family or life that you can attribute that I am correct when I say that. Okay, so one thing that works well, one technique of mindfulness-based training is called progressive muscle relaxation. So there's a relaxation group, and then there's a meditation group in this study. Meditation, is breathing introspection, where you just notice what's going on in you. Sometimes there's a chant involved. Sometimes there's a repeated phrase. So they look in a control group. So 3 groups in this study: relaxation, progressive muscle relaxation, meditation, control, only 20 minutes a day for 12 weeks. And the pain scores were lower after 14 weeks in the relaxation and the mindfulness groups, but not the control group. And they also had better quality of life scores. Just from progressively saying, relax toe muscles, relax foot muscles. I mean, I'm simplifying this. There's ways to do this properly. Relax calf muscles. Just by sort of being within yourself and sensing yourself and sort of feeling that control, people felt better. They had less pain. Okay, and They've done functional MRI studies showing what's going on in the brain. They've done biomarker studies in serum, multiple animal studies, which are called preclinical studies. And we know that this stuff works. So the mechanism behind the success of mindfulness has to do with certain pathways in the brain where these electrical circuits from the peripheral receptors through the transmission line that go to the brain, how they are modified in the brain before you're allowed to say what you know, to have a perception. So the same areas, non-opioid pathways in the brain that handle pain were engaged with mindfulness. And they found that by doing MRI studies where certain areas would light up based on what was happening. This was a very distinct result from placebo. Remember, placebo is the most studied drug ever and the most successful drug ever. Placebos work amazingly well. Placebo is based on expectation, beliefs, and mindset. And they think that this mindfulness, where you actually control your own mind, works in a different pathway than placebo itself, but it works. And they've proved it. You can restructure the reward processing centers of your brain with neuroplasticity using mindfulness. That's like getting over your sugar addiction. You can do the same thing with managing and modulating how you respond to different painful stimuli. And then improved stress resilience happens with mindfulness too. So, you know, like normally if you get, let's say, an overdue bill in the mail, let's say you fly off the handle and you went crazy, that means you have no stress resilience. Well, you can improve your stress resilience and kind of get that overdue bill and then say, okay, well, how am I going to deal with this? As opposed to flying off the handle, just with mindfulness-based training. And actually, you can get better stress resilience from sitting in Finnish saunas, the hot saunas, and or with cold exposure, which we could talk about at some other talk. So these are the studies I'm talking about where they show different areas of the brain lighting up with pain, and then if you meditate. So you can actually control how your brain responds to the electrical current. Remember, it's just ions, it's just sodium, potassium, chloride. So you can control how the channels open and close based on mindfulness training. I mean, it's pretty miraculous. And it has to do with controlling cortisol levels and neuroplasticity. So you basically have less pain related to the afferent processing. Remember, afferent means signal from outside in. So you have less pain because you process that nociceptive, painful information differently. Wait, go back. And then, that just threw me off, sorry. And then also an improved mood helps. So you've probably noticed this, happier people, more positive people for any given insult or injury have less pain or seem to handle it better. Well, there's a reason for that. Positivity reduces pain ratings. They're showing this in study after study after study. And this is because the prefrontal cortex, your executive level part of the brain, controls things better in happier people and positive people. You have more ability to be an executive of yourself. Your prefrontal cortex works better, which modulates most of the signals from the hypothalamus and all the pain centers that are a little bit more primitive. This pictograph on the right is sort of the cascade of the problem with too much glucose in the blood, hyperglycemia, going to form advanced glycation end products, causing oxidative stress, reducing oxygen to the nerves. That's what nerve hypoxia is. So you'll get peripheral arterial disease like the atherosclerosis and the plaquing. Well, if a nerve doesn't get oxygen, it's not going to work right. Then you get inflammation, then you get brain inflammation and nerve inflammation, you get injury, so on, and you get pain. So what are the ways we can treat nerve pain? Well, if you are obese or overweight, the best thing you do is lose weight. Energy excess or too much glucose in your serum is not compatible with optimal living. Exercise helps a ton because it pulls glucose out of the bloodstream, reduces inflammation over time, and it does a whole bunch of repair and protein synthesis things that reduce pain. Proper sleep is probably the most important thing people can do for pain. Omega-3 fatty acids, we've talked about a bit. D3, we've talked about. Things like resveratrol or pterostilbene, which is from blueberries. These are extremely powerful plant-based antioxidants that reduce pain. I just read a great study where they actually combined resveratrol and Mobic for knee arthritis, and it worked wonderfully. Better than Mobic alone, better than placebo. So I love resveratrol. I take it for longevity, for brain health, and for the nootropic aspects of it. But I also take it because it's a very strong antioxidant. And I know with stress and the American diet and the pollution around me, I have constant attacks of oxidative stress. So I take resveratrol to fight that off, and it does treat pain. Alpha lipoic acid is a great antioxidant that goes into the fatty cell layers and also the more hydrophilic or water-loving cytosol. So it can actually function as an antioxidant on both sides. Also been shown to reduce pain. In fact, that's one of the frontline treatments or first-tier treatments in Europe for diabetic neuropathy is ALA. Chlorella is an algae that detoxes or chelates heavy metals. Remember I told you heavy metals are a toxin that can cause pain? Anything you can do to pull heavy metals out of your system, from sweating in a sauna to exercise to taking chlorella and other chelators, ALA too, helps. Turmeric is another great natural anti-inflammatory. I try to put all my patients with pain, be it nerve pain or arthritis pain, on baseline control of inflammation with natural products in the hopes that they will end up taking the synthetic drugs less often and at lower doses. And by and large, it's borne out and it works. So tart cherry extract, turmeric, palmitoyl ethanolamide, we talked about that. NMN is a precursor of what's called NAD, which is massively important to the bioenergetics of the cell. I don't know, way back in the earlier part of the talk, I told you about mitochondria needing to be productive to produce energy for that sodium pump to work, and obviously for other things to work in the nerve cell. If you don't have enough NAD, then you don't have enough ATP and nothing works right. And as we age, we get less and less NAD. So I take NMN every day just to get that up, just to optimally function. Glycemic control, can't stress it enough. This is where you have your metformins, your Ozempic, all these drugs that are meant to manage diabetes. Well, you can get it naturally through a substance called berberine, which is a type of a tree bark. It works just as well as metformin. That's been shown in multiple preclinical and clinical studies. And it's natural. And we have one in our product line. You can get over the counter. Just make sure it's, it is what it's supposed to be. And then, of course, mindfulness and meditation, the progressive muscle relaxation we talked about, the transcendental meditation. And then if you can get into a good cognitive behavioral or mindfulness-based pain therapy protocol. All of these are natural ways that in studies have worked as well or better than those other drugs I talked to you about. And these are way safer. And the side effect of all of this is better vascular health, better brain health, more longevity, better function, better GI system. Everything gets better if you can do these things naturally, if you can empower yourself. Okay, PEA we talked about a bit, palmitoyl ethanolamide, a natural fatty acid amide. It's in the same family of substances as is what CBD upregulates, anandamide and 2-AG. So it is one of the ligands or neurotransmitters in the endocannabinoid system. So this regulates the inflammation around peripheral nerve endings. PEA is strongly recommended for chronic neuropathic pain conditions like diabetic neuropathy, arachnoiditis, things like that. It's very natural. You make it yourself in your own body, just not making enough if you have neuropathic pain. Alpha lipoic acid, that too. Additionally, same as PEA, same as anything natural, you're never going to get that single molecule sudden change in how you feel like you do with synthetic drugs. Most of the synthetic drugs either turn on or off an enzyme, so you get a quicker effect. The ALA is an antioxidant. It has to be incorporated into each cell's antioxidant system, so it takes a number of weeks. I tell people to give natural medicine 2 to 3 months before they try to decide if it helped them or not. Basically, it helps the calcium channels function better and more appropriately, which remember is very important at that terminal bud at the synaptic cleft. And actually, they've studied ALA and it gives more pain relief than placebo. It's very, very safe. And if you combine it with CoQ10, it works even better for things like peripheral neuropathy, because CoQ10 is it's an antioxidant too, but it's mandatory for the electron transfer. So you cannot make ATP, that energy you need for that pump, without CoQ10. So the two together is very, very good for neuropathic pain. So those are just some of the natural things you can do that are much safer than the drugs we prescribe and have as good or better results. And the side effect is general health and good antioxidant status.